Yun. So, good morning, grade 10 students. Another week. Napakabilis po ng araw kasi last week, PE lang po. Or PE po yung ating pinag-aralan last week. Now, today we are going to discuss the Module 1 in Health 10. But before that, of course, ito po yung objectives ng ating lesson for the day, for this week. And at the end of the lesson, the learners should be able to 1. Explain the guidelines and criteria in the selection and evaluation of health information, products, and services. Number 2. Discuss the various forms of health service providers and healthcare plans. Yeah. First, let us know what is consumer health. Yeah. Bago po tayo dumako doon sa 3 components of consumer health, kailangan muna nating malaman kung ano ang nga ba or what is consumer health. So according to this source, consumer health is not just about buying health products and services. It is also about making decisions and having a clear and deeper understanding to make wise choices. Therefore, in choosing products, kailangan natin ng wise choices, of course, and you must consider the criteria and guidelines po. So, ano yung mga guidelines na yan? Ito po. Guidelines on the purchase of goods and services. 1. Evaluate which products and services will be beneficial, harmful, or useless. Tama naman po, di ba? So, kailangan bago tayo mag-purchase ng product, for example, gamot, tatanong muna tayo sa pharmacist o kung sino man po yung tao or personnel na pwede natin pagtunangan kung yung product ba na bibilhin natin or yung gamot na bibilhin natin ay harmful or useless. Pwede rin namang ito yung effective na gamot para sa atin. So, kailangan wise choice dapat. Next, we have to know the local laws and regulations that protect consumers. 3. Locate dependable medical, dental, and nursing services. 4 is to apply knowledge acquired with respect to personal and environmental health and the purchase of personal goods and services. So, ito po yung guidelines on the purchase of goods and services natin. Now, we have here some tips on how to be a wise consumer. Number 1, gather correct and sufficient information. 2. Compare and contrast details of available products. And 3 is to inquire for more and review if possible. Number 1, bakit kailangan po nating mag-gather ng tamang information and sufficient information? Kasi hindi po natin alam kung lahat ng bibilhin natin or yung bibilhin natin na product ay magiging effective or useful sa atin. So, kailangan bago tayo bumili, kailangan sufficient ng information, correct? And kailangan kung nahihiya kayo magtanong sa mga sale personnels nila na talagang dapat direkta nating itatanong, huwag po tayong mahiya. Sa kanila po tayo magtanong para tama at sufficient ang information na nakukuha natin. Number 2 is to compare and contrast details of available products. Karaniwan po ganyan. Kasi hindi lang naman isa ang nagbebenta ng produkto. So, we have to compare po kanino pa or sino ba yung mas maganda or magiging useful or mas effective na product kung sakaling bibili tayo. And 3 is to inquire for more and review if possible. Kagaya nga po ng sabi ko kanina, kapag meron na kayo natitipuhan, huwag po kayong mahiyang magtanong mismo sa mga personal agents tuloy, sale personnel, kung totoo ba or tama ba enough yung information na nakuha ninyo tungkol dun sa product po. Now, we're going to move on to the 3 components of consumer health. 1, we have health information. 2, health products. And 3, health services. Iisa-isahin po natin ang 3 components na yan. Okay, for health information, it is any concept, step, or advice that various sources give to aid the health status of an individual. So for example po, this product, dito sa product na to makikita natin na we have the name, location of manufacturer, warnings po, yung mga precautions, so that's information. And then makikita rin natin sa ibang product, nandun yung content or ano yung ingredients ng kanilang product, so that's information also. Ano pa po, paano gamitin ang product, nakalagay din po yan sa product na ating bibilhin. So yun po yung tinatawag natin na health information. Okay, so saan nga po ba nanggagaling ang mga information ng mga products? So meron tayong dalawang sources. Ito po yung reliable and unreliable. First, we have reliable source. Number 1 is medical and health professionals, including the family and school doctors, dentists, nurses, health science educators. Madaling sabi po, ito po yung mga lisensyado or licensed professional. Next, number 2, government agencies like Department of Health or DOH, Food and Drug Administration, FDA, Bureau of Food and Drugs or BFAD, Department of Trade and Industry, yung pong DTI. Number 3, websites ending in gov, edu, and org. So, warning lang po, meron na po kasi mga websites na hindi siya legit. So, sabihin natin na may ganyan mga gov, edu, and org sa dulo ng website, maaari pong hindi legit yung iba. Maaring may virus, maaring scam. So, beware po. Warning lang naman po yan. Number 4, local health officials. Yan, sa mga barangay health centers po natin, makita natin mga health workers. Sila rin po ay isa sa mga reliable sources of information. And number 5, educational institutions. Yan po, schools, of course. And now we have the unreliable sources of information. Number 1, outdated customs, practices, and superstitions without scientific basis po. Kaya mga paniniwala dati or paniniwala na hanggang sa ngayon ay buhay pa rin ang galing sa mga matatanda without scientific basis. For example po nito, yung kunwari, ang isang tao may sore eyes. Kailangan daw pagkagising mo sa umaga, patakan ng ihi or patakan ng gatas ng ina para mawala yung pamumula or pamamaga. So, hindi natin basta-basta pwedeng paniwalaan kasi hindi pa naman napapatunayan kasi wala nga pong scientific basis. Next, number 2, information based on ignorance and prejudice. Ayan. So, wag po basta-basta maniwala sa mga information na yung minsan kalokohan lang po. 3, commercialized health information. And 4, personal options and incomplete information. Number 5 is yung quack or pseudo healer. Excuse. Ito po yung tinatawag natin na albularyo or mga unlicensed healer. Sila po yung gumagamit ng ang dahon-dahon, mga gamot or bagay na ah, hindi nakikitaan ng scientific basis na magpagaling. So, ang tawag po dun is quack or pseudo healer. So, that's for reliable and unreliable sources natin for health information. Now, we move on to health products. Health products are food, drugs, cosmetics, devices, biologicals, vaccine, etc. Example of these health products, we have eyeglasses, salamin, appliances, yan, ref, washing machine, oven, um, vacuum cleaner, aircon, etc. And we have drugs, medicines po hindi yung bawal na gamot. And we have the grooming tools or grooming aids. Ayan, pampaganda, pampagwapo. Next, health services. Health services refer to the furnishing of medicines, medical or surgical treatments, nursing, hospital service, dental service, optometric service, and complementary health services, and usually offered by health providers. So, sino po ba yung mga health providers natin? Ayan sila. So, we have three types of health providers. Una po ay yung tinatawag natin na health professionals. So, these are individuals who are licensed to practice medicine and other allied health programs and work in the medical profession. Examples, doctor, nurse, nutritionist, etc. Next, we have healthcare facilities. These are places or institutions that offer healthcare services. Examples, hospitals, walk-in surgery center, health center, extended healthcare facility. Number 3, health insurance. It is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Example po natin ng health insurance is PhilHealth. PhilHealth or Philippine Insurance Corporation. It is a government-owned and controlled corporation created through Republic Act 7875, also known as the National Health Insurance Act of 1995. It aims to provide health insurance coverage for all Filipinos and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. PhilHealth ensures that every Filipino is a member by covering them under different membership programs which are categorized according to various sectors of our society. So, i-example ko na lang po yung sarili ko. Class na po. Ako po ay isang teacher, public teacher. So, categorize po ako as member of PhilHealth na binabayaran or automatic deducted po sa salary ng teacher or sa akin. So, automatic po yan. Kapag dumating ang sahod, kakaltasan ng sahod, na i-contribute or ibibigay sa PhilHealth. Para po saan yun? Para kung sakaling hospital or magkasakit ka, meron ka pong may hinga ng tulong or PhilHealth na po ang bahala dun sa bill na gagastusin nyo sa hospital. Pwedeng wala kang bayaran, pwedeng discounted po. So, ganun po ang tulong ng PhilHealth sa atin. So, we have a category, tinatawag nga natin ang category sa various sectors of our society na pwedeng magpa-member. Ito po sila. So, classifications of PhilHealth members. Number one, we have employed or members in the formal economy. Yan. Number two, employed or members in the informal economy. Number three, indigent members. Number four is sponsored members. Five, lifetime member. And last but not the least, the senior citizen po. Example po ng PhilHealth ID kapag nakapagpa-member na po kayo dito. Ito po yun. Ito po yung latest PhilHealth ID. Ayun, so my dear grade 10 students, thank you for listening and watching this video lesson. Lagi po natin tandaan na all of us are consumers. We acquire health information, purchase health products, and avail of health services to appraise, improve, and maintain our health. Health information is an idea that we hear from people around us, read from books and other printed materials, or from the media that influence our health. Health products are items that we consume to improve our well-being, such as medicine, food, clothes, furniture, electronics, etc. To ensure consumer health, criteria and guidelines in selecting health products or services must be considered. Various forms of providers and plans must also be known to a consumer. Health services are programs we avail from various providers such as physicians, nurses, therapists, health workers, hospitals, clinic, and the government. Some examples of these health services are insurance, treatment and cure, and complementary and alternative medicine. And in this light, we must all be educated consumers. Now, that's the module 1 in Health 10. Thank you for listening and God bless.